Criteria of rheumatic fever. The criteria, it includes two, that is major criteria and minor criteria. Major criteria includes joint involvement, that is J. Major criteria, the mnemonic for major criteria is Jones. J for joint involvement, O for O looks like heart or equal to myocarditis. N is nodules, subcutaneous nodules. Then E, erythema marginatum. S, Sydenham's chorea. In major criteria, the joint involvement, otherwise known as polyarthritis or mono or polyarthritis. It is the common finding in rheumatic fever. Mainly, larger joints will be affected in case of rheumatic fever. But in case of osteoarthritis, smallest joint will be affected. So here, in rheumatic fever, the larger joints, mostly knees, ankles, elbows, wrist, all these joints will be affected in case of rheumatic fever. So it may be mono or polyarthritis. Next feature is carditis. O is for heart or myocarditis, inflammation of the cardiac tissue. And carditis, it may involves all the layers: endocardium, myocardium, pericardium. All these layers will be infected. There will be inflammatory response related to rheumatic fever. That's why we are saying rheumatic pancarditis. Okay. Next one, N, that is nodules. And that is subcutaneous nodules. It is usually associated with severe carditis, and the characteristic feature of subcutaneous nodule is when we are palpating, it will be firm, small, hard, painless swelling located over the extensor surface of the joints, particularly knees, wrist, and elbows. So, subcutaneous nodules, it is firm, small, hard, painless swelling located over the extensor surface of the joint, particularly knee, wrist, and elbows. Next one, erythema marginatum. Erythema marginatum, it's a lesions less common in rheumatic fever, in acute rheumatic fever, but it may present in rheumatic fever. The erythema marginatum, the appearance will be the bright pink, non-pruritic, map-like macular lesions occur mainly on the trunk and proximal extremities and may be exacerbated by heat or warm bath. So, erythema marginatum means here there will be bright pink, non-pruritic, map-like macular lesions on the trunk and proximal extremities, and it can be exacerbated by warmth or heat. So that is erythema marginatum. Next one, Sydenham's chorea. Sydenham's chorea or chorea, it is the major CNS manifestation of rheumatic fever and often a delayed sign occurring several months after initial infection. So, if we are not treat the condition well, it leads to complications like CNS involvement will be present, and it is characterized by the chorea. It is characterized by involuntary movement, especially of the face, limbs, muscle weakness, and disturbance of speech and gait will be present. Next one, minor criteria. Minor criteria, the mnemonic for minor criteria is CAFE-PAL. C means CRP will be increased, A means arthralgia, pain in joints. F means fever. E means elevated ESR. P means prolonged PR interval in ECG. A means anamnesis of rheumatism. L means leukocytosis. Anamnesis of rheumatism means here we are taking the history of streptococcal infections in the patient, previous history of skin infections, or is there any history of streptococcal infection previously. So all this history we will be take. So that is regarding the minor criteria. Leukocytosis means increased WBC count. So the mnemonic for the John's criteria is John's Cafe Pearl. And diagnosis will be based on throat cultures, growing group A beta hemolytic streptococci or elevated anti-streptolysin or titers plus two major criteria or one major criterion and two minor criteria. For example, if the patient have polyarthritis plus two minor criteria means if CRP is increased and the patient have fever along with the other diagnostic features, we are concluding that the patient will have rheumatic fever. Otherwise, if the patient have two major criteria, if there is carditis and the joint involvement or erythema marginatum or Sydenham scoria is present, then we are concluding along with the antistreptolysin or the throat cultures. Okay, so that is regarding the John's criteria in rheumatic fever. Thank you.